In today's lecture, we're going to switch to education and we're going to talk about goals and objectives. So in the instructional sequence, we start with goals, move on to objectives, which are more specific types of goals, and then plan learning activities and finally the evaluations to see if the learners have met the goals and objectives through the planned learning activities. So goals are general statements of learning outcomes. For example, this is an example of a goal, which would be after the lecture, the learner will understand the principles and procedures in the urinalysis laboratory. You can see this is very broad. It's just kind of, we want them to learn about urinalysis and the procedures. Whereas objectives are specific statements describing the knowledge, skill, or attitude that a learner is expected to demonstrate after the instructional activity. So these are much more specific. For example, the one written below is after the demonstration and guided practice. That's the learning activity. The learner will identify normal and abnormal constituents in the urine sediment with 100% accuracy. So for this, the objective is that the learner will identify normal and abnormal constituents in the urine sediment. And then it has conditions such as with 100% accuracy. And we're going to go into how to write good objectives in this lecture. So the advantages for the students, you should have in your time here in the program notice that the faculty give learning objectives, and that's because they are great guidelines for studying. So without objectives, many learners are put in a position of not knowing what is expected of them until they see an examination or until they receive an evaluation. So they're kind of in the dark trying to figure out, okay, what do I need to study out of these hundreds of slides that I've been given? And objectives are very useful for helping students focus their studying because they're told what they need to know. It's also helpful for evaluating your own progress so you know how you're doing. It can also help communicate with the instructor about problems by providing specific points for questions or discussions. So you can be like, oh, I see in the learning objective that I'm supposed to know this. Can you add more information on this? Because I don't feel like I have it fully covered based on the lecture alone. So things like that. And then it also helps the students make the evaluation process less threatening because they know what they're going to be tested on. So it's not scary because if you go through the objectives and you know you can answer all the objectives, then you should be good. So the advantages for the instructors to writing objectives is that it helps the instructor focus on the main points, because otherwise the instructor can go off on tangents and get sidetracked, and they might not teach the students what's actually most critical for them to learn. It also helps an instructor determine what the learner should already know. It can also help evaluate the effectiveness of teaching methods. So if many learners have difficulty of attaining a particular objective, the instructor can choose to spend more time on that objective or try a different teaching strategy. And then it can also help provide valuable tools in constructing tests. So usually as an instructor, you have your learning objectives, and when it comes time to make the test, you just go through the objectives and write questions about each objective. So that way you've ensured that your questions are based on the objectives. And then it also allows the instructor to give concrete feedback to the students, because they can be like, hey, Sally, I see that you're not meeting the objectives A, B, and C. Let's see if we can work on that. So the instructor can give positive feedback on the objectives the learner has mastered, and then point out the objectives the learner has not mastered, and discuss the steps the learner needs to do to master the remaining objectives. So it just really helps provide concrete feedback. So are objectives required? A lot of times instructors won't make them. In our clinical laboratory science program, they are required because accredited programs such as our clinical laboratory science program require that there be objectives. So NACLS, our accrediting body, does require that we write objectives for every class. And in addition, most continuing education programs require that objectives are written before they assign credit for the program. And the one reason why you ask, well, if objectives are so great, why doesn't everyone use them? Number one, they are time consuming to write. It's really annoying to do it, and to write good objectives. And then a lot of times, if you're not familiar with writing objectives, it's difficult to get them at higher cognitive levels, so they tend to focus on lower cognitive levels. And some instructors feel like they limit the flexibility in your teaching. So the first two problems can be resolved when the objectives are written and used correctly. So well-written objectives for a particular learning experience should stimulate critical thinking abilities and allow the instructor flexibility in teaching methods. Writing objectives is time-consuming, especially the first time a course or continuing education session is developed. However, in subsequent years, you just have to tweak them so it's not nearly as time-consuming. So the amount of time you put in at the beginning is worth it in the end. And then if you write well-written objectives, they should be able to focus on higher cognitive levels. So how do we write objectives? So the general guidelines is that you want to remember the ABCs. And the ABCs stands for audience, behavior, conditions, and standards. And each objective should contain the ABCs. And we're going to talk about each one of these in more detail. So the first part is the audience. So you don't necessarily have to say the audience is learners in their second year of a CLS program, but you do need to make sure that your objectives match the educational levels and needs of the learners. So your objectives would be different for people who are professionals in the field already versus like high school students that you're going to talk to. So you need to make sure that your objectives match your audience. And then you want to specify the terminal behavior, which is B, and that's terminal behavior is what's required of the learner. So what do you expect them to be able to do after completing the instructional activity in order to demonstrate that they've mastered the objective? So for example, some terminal behaviors identify the specific antibody, calculate the mean and standard deviation, or list the components of complements. And these have different kind of taxonomic levels of their difficulty, and we'll talk about taxonomy later on. And then the next guideline is that there needs to be conditions or boundaries which will be placed on the learner. So this will be, this is helpful knowing, especially for the learner, of knowing what they're going to have access to or not have access to. So this would be like, given a procedure manual, the learner will be able to do blah, 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 blah. Or given a calculator, the learner will be able to. And then given the frequencies of blood group antigens, because imagine you had to calculate the frequency of finding a certain antigen in the blood and you weren't given a frequency table and you'd have to have memorized all that. That would be way more daunting than knowing that you're going to be given the frequency of the antigens and just needing to know how to calculate it. So this helps clarify what you will be given, and which makes it less scary in a lot of cases and helps you prepare for the assessment better. And the next thing is you need to state the standards of the performance. So this is how well the learner must be able to perform the objective to be considered acceptable. So some things are like within 30 minutes, with 90% accuracy, within 2 standard deviations. So kind of what the expectation is of how well they're going to do it. So some instructors assume 100% accuracy when no standards are stated. So sometimes if its standard isn't stated, it just kind of assumes 100% accuracy. And other instructors use standards for all objectives. So it just depends. And sometimes you can have it in like a paragraph at the beginning of all the objectives. So additional guidelines to writing objectives is the degree of detail. So you want the objective to be detailed enough that the desired learning outcome would be recognized by another person in the profession. So you don't want it so vague that when someone reads it, they're like, what did you mean? You want it to be clear enough that someone's like, oh yeah, I know what you want them to know. And then you may need more than one sentence. So an objective doesn't have to just be one sentence. You can have like another one on there too. It's also helpful to use examples that can help clarify what the instructor means by giving the learner an example of an acceptable behavior. So the following is an example. So for each blood product listed in the transfusion medicine procedure manual, so that is the conditions, the student will correctly list the storage temperature and the shelf life. And then it has an example of AS1 red blood cells. And then it has the temperature and the days of storage. So that kind of helps the learner figure out, okay, that's what they want me to know. Cool, let me go figure it out for the rest of the products. So other general guidelines. So let's kind of review some here. Okay, so I have an example here of a objective. Here it is. It's cute. It says, given I never know how to say this word, given a Neubauer counting chamber, the learner will be able to perform manual white blood cell counts on 4 cerebral spinal fluid samples with 90% accuracy. So let's identify the terminal behavior. So that's ultimately what the learners will be able to do. So that is perform a manual white blood cell count. And then the conditions, we have given them a counting chamber. And then the standards, 90% accuracy. So this meets our criteria of a good objective. Then we have, this is another example of an objective. After completing the reading assignment and observing the demonstration on routine urinalysis, the student will be able to perform the following tasks with 100% accuracy. So then it has a list of steps in the routine examination, describe the clinical significance of turbidity, identify abnormal results in the physical, chemical, or microscopic examination. So the terminal behavior for objective 1 is we have list the steps. Pretty simple. The conditions for objective 2, this one is actually hidden up in the main sentence, the main like introductory paragraph, which is after completing the reading assignment and observing the demonstration. And then the standards for objective 3 with 100% accuracy. So you can have these introductory paragraphs that can get rid of a lot of the need to make these really long objectives to have all the ABCs in there by having an introductory paragraph. So we have after completing the reading assignment and observing the demonstration, and then what the expected criteria, like standard is. So then on the subsequent objectives, you just kind of need to put the behavior that they need in there. So it saves time and paper. So action verbs for objectives. You just can't kind of choose any old verb. It needs to be a verb that has that describes an observable behavior. So these are things like calculate, list, repeat, diagram, explain, discuss, things like that. You need to avoid general or ambiguous verbs like understand. How can you tell if someone understands something? If I'm like, hey student, do you understand that? They'll be like, oh yeah, totally, I understand it. And then according to my objective, yeah, sure, they're good, but I don't actually know if they understand. So you need to be something less ambiguous. So appreciate, no, these are all things that you can't really, they're not observable behaviors. They're not helpful for writing a test question or actually figuring out if your student knows what they're supposed to. So some common errors that occur in writing objectives, so make sure you don't do these when you're writing yours, is that the first should be making sure that the emphasis on what the learner will do. A lot of people will write the objective in terms of what the teacher will do, and it's supposed to be in terms of what the learner will do. So let's look at some examples. So which one is well written? So the first one is to increase the learner's ability to visually identify microorganisms on a culture plate. So this one sounds like the teacher's trying to increase the learner's ability. And then given a culture plate, the learner will be able to identify microorganisms by visual inspection with 100% accuracy. So this one's talking about what the learner will do. So this, number 2, is the better objective. So some common errors in writing objectives. Another one is that the focus should be on the learning outcome rather than the learning process. So it's not how they're learning it, it's whether they actually learned it. So let's look at our 2 examples. It says, after the lecture, the learner will be able to correctly calculate the concentration of an unknown using Beer's law and standard curves. And then the next one is, after the lecture, the learner will gain knowledge of Beer's law. The first one is very definitely a well-written objective. The second one is kind of like, okay, they're going to gain knowledge. That's cool. If I didn't know anything and I learned one thing, then I've gained knowledge, but I might not know as much as I need to. So it needs to be clearly stated of what the outcome is and also what the standards are and the terminal behavior. This is just very vague. And unfortunately, you're going to see these types of objectives written by instructors who don't know what they're doing. So another common error is that the objectives should describe the instructor's expectations of the learner rather than the course content. So it's easy just to kind of give an outline of like, okay, in this class, we're going to learn about the formation of red blood cells in the bone marrow. That sounds good. But that doesn't actually, that's more of a goal rather than an objective. So the better objective in this example is given 5 bone marrow smears, those are our conditions, the learner will identify red blood cell precursors, that's our terminal behavior, with 90% accuracy. And that is our standards. So this tells them what they're actually supposed to do rather than just red blood cells are formed. It's like, that's cool. I'm glad I'm going to learn about that. But you have no way of knowing how you're going to be assessed on that. So general terms that are open. So another thing is that general terms are open to a variety of interpretations, should be avoided. So which is well written. So after the lecture on tuberculosis, the student will, 1, understand the use of molecular methods in detection of Mycobacterium tuberculosis, or 2, accurately describe the molecular method used to detect Mycobacterium tuberculosis. So we have this whole vague word again, understand. How do you assess if someone understands something? And then this is also kind of vague. It's like there's a lot in here. So this is accurately describe a molecular method. So this is more clearly defined, because understand is so vague. Like, what does that mean? Are you going to have to write an essay? Are you just going to have to list something? How are you going to show that you understand something? So you want to avoid vagueness or anything that has some ambiguous meanings. All right, so that's how you write objectives. Now we're going to talk about the different types of objectives. So there's classifications of objectives. These are called domains, and there's 3 domains: cognitive, affective, and psychomotor. So the cognitive domain emphasizes intellectual learning outcomes. So these are things like just memory, like knowledge. Whereas affective domain, it involves values, attitudes, and interests. So these are more internal feelings. It's more touchy-feely. And then psychomotor involves activities requiring neuromuscular coordination. So this is where doing lab stuff comes in. So this is where you show that you can pipette. Not necessarily cognitive or intellectual based, but physical based. So why is this important to have these classifications of domains? So it ensures that all the important learning outcomes are addressed. So if you have an educational program that only has cognitive objectives, people might have the memory, they might be really good at taking tests and have the knowledge necessary, but they can't pipette, or they don't understand why it's important to follow HIPAA rules and not discuss patient information. So they need to have these other objectives to make sure that they're learning the psychomotor and affective domains. Having these objectives also guides and improves instruction so that you can choose the right learning strategy to best fit the type of objective. And then it also meets accreditation requirements, because the accrediting agencies do require that you have more than just cognitive objectives in there in your classes. So the domains are arranged in a hierarchy from the simplest behaviors to the most complex, and these are called taxonomic levels. So a simplified version is sufficient for our means, where there's 3 levels. In reality, there's actually like 6 or more for each domain, but for our purposes, we're going to focus on kind of 3 classifications or taxonomic levels. So the first is the lower level objectives, the middle level objectives, and the higher level objectives. And depending on the domain, they have different names for each of these levels. So in the cognitive domain, the lower level is recall. And this is just straight, you memorized it, you regurgitated the information, so you're just remembering learned information. The second level is kind of the mid-level. This is application. So this is understanding the information and then applying it to other material or new situations. So this isn't just rote memorization, it's a step further. And then 3 is problem solving. So this is where you're analyzing the information, reorganizing it, synthesizing, making decisions and judgments based on the information. So this is more critical thinking involved. So this is where you take a case study or you're troubleshooting an instrument and you're taking all the information you've learned and utilizing it. And then for the affective domain, our lowest level is awareness. This is just knowing that something's there. So this is awareness of an activity, situation, or phenomenon. So this is like being aware that you need to show up to work on time and complying with that rule. And then, so this includes like compliance with existing values. So like you are aware that HIPAA exists and that you will comply with the laws of HIPAA. The second in taxonomic level in the affective domain is valuing. So this is attaching worth to an activity, situation, or phenomenon. So this is like, I believe that HIPAA is important and that I should do it. And then the third one is commitment. So this is the ability to defend or justify values and resolve conflicts between values, resulting in a consistent value system. So this is where you've really internalized something and you're committed to it, and it's part of your like central being. So you're like, I will never say something against HIPAA because I know how important it is to follow HIPAA, and I can justify it to someone else. So this is really internalizing those values and making them a part of yourself. And then in the psychomotor domain, our lowest level is readiness. So this is basically awareness of stimulus, a readiness to perform a motor skill. So this would be like gathering your materials for a procedure, labeling tubes, things like that. You're ready to do it. Proficiency is when you actually start doing the motor skills with increasing proficiency and confidence. So this is when, as you've started practicing doing blood typing, you no longer have to look at the procedure every step of the way. You can do it proficiently. You don't need instruction. And then adaptation is the ability to alter procedures or to create new movements. So this is like, okay, something's gone wrong with my lab in chemistry. How can I correct it? So this is where you start to adapt, and because you've learned enough that, and you've done it enough times that you kind of know how to fix things. So this is where choice of verbs comes in when you're writing your objectives. So some verbs are more applicable for one domain or for one level than another. So we're going to go through these verbs and try to figure out what domain and level they're at. So the first one is calculate. So calculate, we're doing something, so that's good, but it's not necessarily like neuromuscular. We're using our brain. So that's going to be a cognitive thing, and it's level 2 because it's not just recalling information, it's actually doing something and applying it. So that's what makes it level 2. Now assemble, that's physically doing something. So that's going to put it in the psychomotor, and then you're not doing a whole lot. So it's level 1. And then advocate, oh, that's a good one. All right, so this is going to be affective. And then it's going to be level 3, because when something has part of your central being, you're going to advocate for it. So that's what makes it level 3. And then list is a cognitive level 1, because it's just straight recall of information, writing something down that you've memorized. Measure is psychomotor and level 2, because it's gone beyond just readiness. You're actually physically doing something. And then explain, that can be cognitive level 2. Some of these verbs can also be used at different levels, so explain could also be at a level 3 as well, depending on what else is in the objective. So here I have a nice little table for you, showing some common verbs that are used at each domain and taxonomic level, so that when you're writing your objectives, you can just kind of pick one of those guys or use it to help with your homework. This is not an end-all be-all list. This is just a small sampling. You can also Google like Bloom's taxonomy verbs and get very long lists of good verbs to use at different taxonomic levels. So we're going to go over some cognitive objectives and try to figure out what level they're at. So given a calculator, that's our condition, the learner will accurately convert degrees Celsius to degrees Fahrenheit. So this is going to be a level 2 because it's more than just recalling information, it's actually doing something, so that puts it at level 2. And then after the lecture on quality improvement, the learner will assess the workflow in the laboratory and make suggestions for improvement. The learner's assessment must include quality assurance and cost effectiveness. This is an example of a 2-sentence objective, yay. So we're assessing and making suggestions. Ooh, that's some higher level skills there. So that's a level 3. So this is kind of what you would have to do as like a lab manager level. And then after reading the chapter on renal diseases, the learner will be able to describe 2 major characteristics of the nephrotic syndrome. So this is level 1. You could have just put list instead of describe, and it would have accomplished the same thing. All right, so when you're writing the affective objectives, this can be kind of difficult because, like, how are you going to assess someone's feelings? So it's important to consider the attitudes or values that the learner is expected to acquire. So things could include like respect for patients' rights, cooperation with fellow workers, dependability, initiative, concern for quality of work, of laboratory work, concern for safety. And you'll state the observable behavior that will be accepted as evidence that the learner has the desired attitude. So let's look at an example. So after the lecture on professionalism, that's our condition, the learner will discuss certification of laboratory personnel as an effective means of ensuring quality laboratory tests for the public. Discussion must include the student's own views on the value of certification. So they're discussing things. This kind of is beyond just compliance. So this is going to put it at a level 2, but you're not quite at, like internalizing it. And then adhere to the dress code in all laboratory rotations at all times. So this is just adherence to the rules, which is level 1. To make that higher, to be like, okay, I need to understand why I'm doing it. Why am I dressing the way I do at work? Not just, okay, I'm going to do it so I don't get kicked out of the lab. And then offer to help others when his or her own work is completed. That's level 3. That's when you're like advocating for something because you know it's so important that you're offering to do extra work. So our psychodomain levels, we're going to do our what level is it game. After the demonstration, the learner will accurately label the tubes in a serial dilution. So we're labeling tubes. This is not a high complexity thing. So that's level 1. And then given a laboratory procedure, the learner will correctly perform the procedure and modify the steps. Ooh, we're modifying. So that puts us at a level 3. And then given a procedure manual, the learner will calibrate the blood gas analyzer. So this is following a procedure, but you've gone more than just readiness. So this is level 2. All right, so some more trial and errors. This is a lot of what your homework is, in addition to writing your own objectives for your continuing education project. So after completing the instructional unit, that's our condition, the student will be able to assemble the reagents and supplies needed for ABO and RH typing. So we're assembling, which is using our hands, but we're not doing a whole lot with it. So this is going to be a psychomotor level 1. And then we're going to be performing the ABO and RH typings according to the procedure given. So this is still psychomotor. Apparently I cannot spell psychomotor. My fingers have issues typing that. And that's level 2. Interpret the results of ABO and RH typings. So interpreting the results, you could do this at the bench or you could do this on a test. So this puts it at the cognitive level in a cognitive domain, and it's a level 2 because you're not just listening, you're interpreting. And then defend the policy of retyping a recently admitted patient when a physician insists that the patient's blood type is A positive, to which I'd say, don't tell me what to do. So this is an effective because you're defending a policy, and it's a level 3 because you're defending. So you have to have it like internalized and be like, this is why we're doing it. I'm just not taking your word. We might kill someone. So effective level 3. So we're going to evaluate some objectives. So when you're evaluating objectives to determine if it meets the criteria, you want to see, does each objective include a statement of the behavior, so that's our B, that is expected of the learner, a description of the important conditions, C, and an indication of how well the learner must perform, which is the standard. So we have B, C, and S of our ABCs, and the audience is implied. The condition may be included in an introductory statement, which we've seen in those little beginning paragraphs, and complete mastery of the objectives can be implied. So you might necessarily have to have the standards listed with, like, for example, like with 90% accuracy could just be implied that it's going to be 100%. Does the objective describe a behavior that is observable? So you have to be able to assess it in some way. Are objectives in the cognitive, affective, and psychomotor domains included when appropriate? So for some things, like it's not going to be appropriate to have a psychomotor domain. And other times it's not going to be appropriate to have an affective domain. Usually you're going to have cognitive domains in there. It's kind of hard not to need those, but you might not always need a psychomotor domain. But if you're doing a lab class and you're writing objectives for a lab class, you should probably definitely have psychomotor domains in there. Are the objectives realistic considering the resources available and the constraints that exist? So is it feasible? Are the objectives attainable by learners given their background and abilities? You would not expect high school students to be able to troubleshoot why an instrument is broken. So it needs to be obtainable. And then are higher level objectives that have application to the new situations included. So instead of getting stuck in this problem of sticking at lower level taxonomy of your objectives, you need to write higher level objectives, at least have some in there that allow application of the knowledge or skills to new situations. So when you're writing objectives for a course, you first need to find out what you need to teach. So what's nice in the clinical laboratory science world is that there are resources that will tell you what is expected for entry-level medical laboratory students to know. One of those is the ASCLS's entry-level curriculum, which can be found online. And this document describes the knowledge and skills that new MLS graduates should possess when they begin working in the field. So i.e., we should, as an instructor, I should make sure that my students know it. And it was developed by an ASCLS committee with broad input from the clinical laboratory educators, and it's intended to assist instructors with course development and curriculum decisions. So we don't want to teach you things that are out of date, or we don't want to teach you more than you need, because otherwise you just get overwhelmed with the information and it's just too much to learn. And you don't need it yet. You'll get that on the job training. There's also the American Society for Clinical Pathology Board of Certification content outlines. So the BOC regularly conducts practice analyses to validate the content of the certification exams. And the result of these practice analysis is a list of tasks that are considered important for entry-level practice. And then the content outlines are derived from that list of tasks. So it kind of, once again, tells instructors what they need to know for the BOC. And you can also get input from your clinical sites. So it's helpful for instructors to see what the clinical sites are doing so that we can make sure that we introduce you to that. So when you go on your clinical rotations, you're not blindsided by what they're doing. You're going, oh, that's not what we did in student lab. So, you know, things transition smoothly from your student laboratory to your clinical lab, to your clinical rotations. You can also do surveys of graduates and employers to see what they're doing. And then this is to assess and improve the program, and it may highlight areas that need more or less coverage in the curriculum. There's also networking with other educators to see what they're teaching. And then there's CLSI documents that are available, what's available in the textbooks, and then your own personal experience of what you did in the lab, because a lot of the instructors have experience in the lab. And then one of the problems is you have all these resources to figure out what you need to teach, but so it might be actually kind of hard to figure out what not to include because there's only so much time to teach. You kind of have to edit yourself. And there's an algorithm to kind of figure out should it be included or not, but we won't go into that here. That was me editing because you don't need to know that. So we're going to critique some more objectives. Okay, so at the conclusion of this lecture, the student will be able to accurately explain requirements for an electronic cross-match. All right, so we have our conditions. So they've done the learning activity. We have our audience, and then we want to accurately explain requirements for an electronic cross-match, and we can assume with 100% accuracy. So on the whole, I think this is a pretty good objective. I don't really have too many problems with it. And then after the completion of this lecture, so we have our condition, the learner will gain knowledge of inheritance patterns and pedigree charts. All right, so we have a condition, so that's good. We have an audience. but our behavior is gain knowledge. How are we going to assess that? So that's not a super great objective because it's got those vague, ambiguous verbs in there of like, how do you assess that? It's just not great. A better way would be the learner will describe the inheritance patterns or make a pedigree chart, that kind of thing, given something, information, additional information. So, and then the following reagents and techniques will be discussed. Then we have our agents and techniques. So what do the learners actually need to know about this? So this one is listed more in terms of what the instructor is going to go over and not what the students are actually supposed to know. So this needs to be completely rewritten according to the ABCs. All right, some more objectives. So upon the completion of the conference, so we have our condition, participants should be able to accurately evaluate the results of screening tests and more complex tests of hemostasis. I don't hate that objective. It's pretty good. And then our next one is the participants will be provided with a better understanding of CLIA 88 requirements for method validation. So this one is not great because it's written in terms of what the instructor is going to do, and it also has those nice vague understand, a better understanding. What does that mean? If I didn't know anything and I learned one thing, then I have a better understanding. That doesn't mean I've met the requirements of what I need to know. So this one's just very vague, and it's written in terms of what the instructor is going to do. The third one is on completion of the course, so we have a condition. The participants will be able to analyze the cost-effectiveness of procedures used for the diagnosis of infectious diseases and identify new emerging pathogens. This isn't a horrible objective. Like, I wouldn't hate it, but it could be a little bit more specific. So I think this would benefit from some examples right here. So, because new emerging pathogens is pretty vague and very broad, and it's like, okay, is there more information? Like, can I have a list of ones I need to know? So this could be improved by just adding some examples. And then some questions to think about after this lecture is, what do you think are the greatest benefits of objectives? And in courses that did not use objectives, how did you decide what exam to study? What did you decide to study for an exam? And why do you think NAACLS requires objectives in accredited programs? So things to ponder. So have fun with the homework and email me if you have any questions, or we can have a Zoom meeting.